Здравствуйте, уважаемые.
Distinguished colleagues, greetings. I'm happy to greet you today on our conference, International Conference Epidemiological Well-being. And as all of you know, we planned to hold the conference as it was before on the regular basis once in 2 years. And we planned to hold this conference in April 2020, but the world situation, the situation related to pandemics, has changed our plans. And together with you, all of we were coping and battling and I'm grateful to you, and I'm very happy that today, on the basis of all of our requirements that were built up during the last year, with participation of the Scientific Society of the International Best Practices, we are able to hold our conference in a complex online and offline combined format. And I want to greet all of the participants, and today in our hall there are 200 delegates from 7 countries from Eastern Europe, Central Asia, our partners from the UNITED program or UNAIDS, UN program, WHO program, and in online regime we have participation of more than 4,300 participants from more than 30 countries of the world. We have representatives of state organs, international organizations, business community, and we are performing online broadcasting and webcasting of our event. I want to tell you that together with us, we are seeing more than healthcare, more than 1,000 representatives of science, 500 state officials and governing bodies, and 310 representatives of community organizations, 22 business representatives, and about 50 representatives of mass media. The conference is devoted to the main challenges of our everyday life, of our everyday work, and this is a very important event in our calendar. And I really hope that these days, and we are having 2 days, 20th and 21st of April 2021, will be devoted to the very important issues and questions, and we are hoping to be engaged in the fruitful discussion on the topics of epidemiology, epidemiological science, because I think that, and I want to state that 2021 is the pandemic year, still not a post-pandemic year, although I wanted to name it post-pandemic. And the conference will be devoted to a broader set of questions and issues, because the infectious diseases, these topics, prevention and combating diseases is the most topical issues. We have 21 concurrent sessions in all aspects of fighting epidemics, herd infections, introduction of international sanitary rules, realization of Russian and international programs, and anti-microbe drugs. I want to thank of the participants, and now I want to represent the guests, honored guests of our conference. Shannon Hayder, the support of the UNAIDS, had Abdul Mazadan Jamalidik Abdulovich, Minister of Healthcare of Tajikistan Republic, Lena Manukovna Onushan, Deputy Minister of Healthcare of Armenia Republic, Alexander Alexandrovich Tarasenko, Deputy Minister of Healthcare and Social Development, Sanitary. And of course, the year 2020 and pandemics have proven and showed to the international community the necessity of the facilitation of international situation of rapid coronavirus infection. The countries throughout combat the enemy, the COVID-19, and we understood for how it is important to support each other and to stay in the constant dialogue, operative interchange of information on the outbreaks, proofs and disproofs of laboratory data on diagnostics. These are very important topics, but still coronavirus is not only one threat to the well-being that is posed to the people in all countries. Pandemics, COVID-19, has seriously negatively affected the healthcare in many countries and can push on the global sustainable development goals 2030, and coronavirus infection and this infectious disease may affect the combating of other diseases, including the HIV and other conditions. According to the data of WHO, in certain countries, the accessibility of HIV treatment and support for the patients and people with HIV was affected by 75%, and one of the most important the scope was planned vaccination and immunizations. More than 100 million of children could miss their vaccination because of the campaigns and against epidemics campaigns. Although we have a decrease in several infections related to the status of the current events, and we say that for example, measles is going down in Russia, and we see that this is also very important and actual topic for us. And the supreme governance of Russia was paying due attention to the immunization, to the healthcare of Russia, and especially President of Russian Federation Vladimir Putin and the government of Russian Federation. And now let me please to open our conference by two very important greetings that are really important for us. That is the greeting from the President of Russian Federation and the greeting from the government of Russian Federation. To the participants and facilitators of the International Conference Epidemiological Wellbeing. Distinguished friends, dear friends, I want to heartily greet you on the International Conference Epidemiological Wellbeing. The problems that are covered by the conference are playing a huge role in all the community and are striving for the international cooperation. The broad pandemics of coronavirus is proving that not one state, even the best developed state, not solve this problem and issue alone without cooperation with international partners. Russian researchers, Russian agencies, pharmaceutical agencies and healthcare agencies have a unique set of experiences in fighting not only coronavirus but also other diseases, flu, measles, HIV and so on. And our colleagues are openly posing their knowledge and sharing their knowledge with the participants of the whole community, international community. And we hope that the result of your cooperative work of this event will serve to the protection of healthcare and well-being of people around the world. I wish you success from the President of Russian Federation, Vladimir Putin. And you know, during the whole period of pandemics, the operative solving of tasks and issues on coordination of activities was subject to the operative staff of the government of Russian Federation, led by the Tatiana Alexeyevna Golikova. She was planning to be together with us, but taking into account the day of tomorrow that is important for our country, Tatiana provided for a greeting for us. And distinguished colleagues, against the pandemics in the first line. In the first days of the coronavirus pandemics, Russian specialists made it real and developed the kit for diagnostics, and we managed to save many lives of our citizens.
We are the first country who managed to develop and register the vaccine against COVID. And as pandemics has shown, the best way to cope with the pandemics is achieved by the countries with centralized means for
Fighting against the viral diseases, and this was the basis that was laid during the Soviet times, and on this basis we are building on to preserve the lives and of our citizens. And although we were fighting against the pandemics, in the focus of our attention were the other infections. We've seen the decrease in morbidity in many diseases. And only in working together we are able to fight the pandemics further, and we are able and we are eager to share our knowledge, to search for the new means of diagnostics and prevention of infections, and we are ready to invest into the operations of the UN and other international organizations. I want to wish you success in fighting these threats. Deputy Head of the Government of Russian Federation, Tatiana Golikova. Distinguished colleagues, speaking about sanitary and epidemiological well-being, we need to especially stress the coordinating and leading role of the WHO, World Health Organization, in organization and realization of efforts in protection of citizens and people around the world. And of course, we are rendering support in international cooperation and organization and facilitation of studies of new coronavirus infection. And I want to state that the consolidating and coordinating role of the WHO from the first days of this disease provided for counteracting, and from the first days of the outbreak of the disease for creating of many working groups along different directions to make the experience, the best experience and best practices acceptable to all of you. And now I want to introduce Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, with his introductory word.
Dear colleagues and friends, when the global HIV epidemic erupted 40 years ago, life-saving antiretrovirals were developed, but more than a decade passed before the world's poor got access. Life-saving vaccines for COVID-19 are now giving us hope for ending the pandemic. But we are still learning the lessons from HIV in terms of the importance of equitable access to these life-saving tools. Around the world, the devastation caused by the pandemic has been compounded by severe disruptions to essential health services, including for people living with HIV and TB. The pandemic is a setback to our shared commitment in the Sustainable Development Goals to eliminate HIV, sexual transmitted infections, and viral hepatitis as public health threats, and to end the global TB epidemic by 2030. I'm happy to note that the accelerated effort to develop COVID-19 vaccines has reinvigorated hope in promising mRNA vaccines for HIV. I would like to thank the Russian Federation for hosting this important meeting and for its support for the Global AIDS Strategy for 2021 to 2026. And we look forward to your continued support in the lead-up to high-level meeting in June. Thank you, and I wish you a very successful conference. Spasiba большое.
Thank you so much. And in this year, UNAIDS is celebrating its 25th anniversary. That means that a quarter of the century, this organization is solving global tasks on the agenda in the healthcare. And UNAIDS is one of our most important partners. And these conferences, for example, as the other conferences, are held together with UNAIDS. And for almost 10 years together, we are rendering help to the countries of Eastern Europe and Central Asia in combating HIV, AIDS, and other infections. And now we want to listen to the greeting word on the video from Winnie Byanyima, Executive Director at UNAIDS. The floor is yours.
Hello. It is our great pleasure and honor for UNAIDS to join the Russian government in convening this very important conference. I'm sorry I could not be with you today, and I'm grateful to my Deputy Executive Director, Shannon Hayder, for being there to represent UNAIDS. While we might not see several issues in the same way, I am very grateful for Russia's engagement as a UN member state in our board, and also Russia's strong commitment to ending AIDS and Russia's support to fighting AIDS in the region. And in coming months, I hope to visit Russia personally. Let me highlight critical issues that are important for all countries of Eastern Europe and Central Asia. First, in recent years, all countries of the region have made progress on HIV. Also, in recent months, we've seen countries of this region making progress against COVID. But let me be clear, we are still not on track to stop COVID or to end AIDS. But the global crisis we are facing today gives us the opportunity to get more serious and fight to end both epidemics. For COVID, this demands that everyone who needs to be vaccinated everywhere is vaccinated, not only those in rich countries. For HIV, this demands that even in the absence of a vaccine, we use all the tools and the evidence-based programs to get every country and every community back on track to end AIDS by 2030. If we've learned anything from COVID, it is that it takes all of government and all of society to end an epidemic so that nobody is left behind. This is the kind of social mobilization we need to reestablish and end AIDS in every country in Eastern Europe and Central Asia. Second, UNAIDS Program Coordinating Board has just adopted a new global AIDS strategy by consensus. This would not have been possible without the support of two member states in this region, that is Russia and Belarus. While I appreciate that there are elements of the strategy that Russia did not support, there are so many there that Russia did support. There's so much in the strategy that is to be implemented with urgency in Russia and in every country of Eastern Europe and Central Asia. 95% of people at risk for HIV should use evidence-based HIV combination prevention services. 95% of people estimated to be living with HIV should know their status, and 95% of people diagnosed with HIV should be on treatment. These are not just aggregate national targets, they need to be achieved in every population and every age group by 2025. And less than 10% of people living with HIV and key populations should experience stigma and discrimination. These are just some of the targets in the Global AIDS Strategy, the most ambitious targets ever adopted by the international community. Reaching these targets by 2025 will put every country and every community on track to end AIDS by 2030. I hope all the targets in the strategy will be fully reflected in Russia's new state strategy against HIV/AIDS. Third and finally, I have two requests about the United Nations General Assembly high-level meeting on HIV/AIDS in June. This meeting will be the greatest test of global solidarity to end AIDS. All the previous political declarations on AIDS included ambitious targets and explicit terminology that not all countries could accept, but that all countries supported by consensus. So I'm asking all of the governments at this important conference to engage in the negotiations in New York on a bold, new, ambitious political declaration that does not lower the bar and that will advance the momentum to end AIDS by 2030. I thank you all, and I wish you a productive and successful conference.
Distinguished colleagues, over the previous year, the aid to some neighboring and foreign countries has also been delivered through the interparliamentary interconnection, and the Federal Council of the Russian Federation played quite a role here, and I would like now to give the floor to Inna Svyatenko, the chairperson of the Committee of the Council of the Federation on Social Policy. Inna, the floor is yours. Good afternoon, distinguished participants to this conference. I'd like to welcome you on behalf of the Federal Council and the Federal Assembly of the Russian Federation. 2020 saw some new infectious disease, coronavirus, COVID-19. It has been quite a test to the whole world as well as to the system of healthcare. It influenced all the parts of our life, and we had to consolidate our resources, our scientific knowledge, to develop the test systems, the medications, to search for some innovative technologies and methods. The Russian Federation prevented the outbreak of diseased cases and the death. And we conducted some large work. And first and foremost, this is due to the work of our medical community. While we were fighting the pandemic, we came up with the opportunity to establish a specific format of the medication registration that was supposed to prevent and cure the diseases that were quite dangerous for the people. To increase the stability of the national healthcare against the epidemiological threats, we adopted the strategy on the development of prevention of infectious diseases up to 2035. And this will serve as a platform to organize our activities and prevent the spread of the diseases, of infectious and other diseases that can be controlled by the means of immunoprevention. I'm sure that during this conference, the participants will discuss the pressing epidemiological issues, the tasks that are connected to the epidemiological well-being, as well as they will exchange their experience and find some ways how to be efficient in this way. Distinguished colleagues, I would like to send the regards from the Deputy Chairperson of the Federation Council, Madam Karelova. She wishes everybody to have some fruitful work, interesting discussions, the enforcement of business contacts, and of course, please stay healthy. Thank you very much for your attention. Inna, thank you very much. Dear colleagues, I would like to say a couple of words about the project that has been underway for a couple of years, and we focused on it quite a lot. This is the program of the aid to the countries of in Eastern Europe and Asia. We've been doing this program since 2013, and more than 2 million people in Eastern Europe and Central Asia got some help when it comes to the prevention of HIV and AIDS, and more than 3,000 people were trained according to the Russian methods. More than 100 different types of items of agents and medications has been transferred. And now we would like to screen some video that will show the results of this very important project for us. The situation with the spread of HIV in the Eastern Europe and Central Asia continues to be tense. The number of infected cases continues to rise. Such infections as viral hepatitis. And a lot of people still miss and lack the medication. The labor migration also affects the situation because the families of the migrated people have to get some information how to preserve their health. In 2019, the humanity faced the coronavirus infection that turned into a pandemic and a global threat that is currently being fought by the whole planet. The fight against COVID-19 didn't only divert the resources from the treatment of HIV and AIDS, but also it has demonstrated that the presence of established systems on the fight against the infectious diseases allows us to be efficient in the fight against the pandemic. To be efficient in this response, the government of the Russian Federation decided to financially support 6 countries in the region: Azerbaijan, Armenia, Belarus, Kyrgyzstan, Tajikistan and Uzbekistan, to deliver some aid to people that live quite far, and it all was due to the mobile clinics. The Russian Federation provides the clinics with medication express tests. It also pays for the transport. The Russian specialists consult and monitor each and every car that is going out. And in these cars, there are 3 rooms that can be used for some medical help. Today, 13 mobile clinics provide help and support. The program of the technical support to the countries of the Eastern Europe and the Central Asia when it comes to the prevention and control of the HIV is supported by UNAIDS, and 240 people got the help. More than 200 people are screened on a daily basis. During the first and second stages, and in cooperation with the Red Cross and other subsequent organizations, we started to launch the educational centers for migrants. With the participation of people in Tajikistan, we also introduced the electronic system of the epidemiological surveillance when it comes to HIV. The equipment has been launched and established. Armenia. 3 mobile groups and teams when it comes to monitoring and HIV testing are working in Armenia. In Yerevan, there is a special center that is equipped with everything needed to that end. With the expert support from Russian specialists, Armenia has developed numerous normative documents and educational training materials when it comes to the diagnostics and epidemiological surveillance. The system of remote training and epidemic surveillance has been established. And in Kyrgyzstan, we see that the diagnostics has been increased 7 times. When it comes to vertical transmission of HIV, we see that there are different sets of activities when it comes to medical aid to children. We also managed to improve the situation with the HIV-positive children. In Kyrgyzstan, we aimed at improvement and development of the labs when it comes to the diagnostics, and we also have transferred to some cutting-edge systems when it comes to HIV testing. Belarus, it has joined the technical program in 2016, and the main development since that is the mass awareness campaign and it is aimed at a popularization of testing. In spring 2017, in the pharmacies in Belarus, they were appearing the express tests on HIV, and it all allowed to interpret the results just at home without visiting a clinic. In 2020, Uzbekistan joined the program of technical support, and the Ministry of Healthcare signed a memorandum, and afterwards the ceremony of the transfer of the first mobile diagnostical center has been conducted, and the first mobile center has been transferred to the authorities. Over the years of work, the program of technical support has significantly improved the situation with the HIV infections in these countries. The efficient system of express testing has been established. The prevention of HIV among children and women has been improved. Also, the surveillance of migrants has been improved, and we've established some professional relations between the clinics and the health workers and other people. And we see that the awareness campaign among the people in rural areas has been underway. Distinguished colleagues, we've seen the work of medical staff in different countries, and we know that the aid that has been provided by UNAIDS jointly with the Russian Federation on the transfer of knowledge and experience, as well as mobile labs from the Russian Federation to a number of countries, it was very relevant and pressing, especially in demand during this difficult period. Our mobile centers and the lab testing clinics helped people that live very far away in some mountain territories. Usually, there are no doctors to render this help, and the mobile centers is the only opportunity. And during this period, we've all been working as a united team in the significance of medical staff, of epidemiologists, microbiologists, and all the medical staff, GPs, the midwives, all the doctors. The help of all these people was very important. During some just calm times, we could have underestimated it, but now we cannot overestimate it anymore. It is not possible. And jointly with the foundation, we've prepared some awards to mark the best people that were assessed by the Special Commission on the Assessment of their Efforts. And now let me conclude this ceremony, this opening ceremony, with the thankful letters and some tours to our neighboring countries, to the sightseeings in different countries, in Tajikistan and others. We will give out these awards to the winners of this award. To reward the employees of the mobile clinics in Armenia, we invite Tamara Onsepan, Lili Daftan is also to receive the reward. Marine Osran is among the winners. To mark the best employees of the mobile clinics from Kyrgyzstan, the first winner is Bura Ursulaeva. We invite Asanbek Zir Alpiri to come to the stage. Venera Murtamilova, please come to the stage for the awarding ceremony. Timur Sharipov is also among the winners among the employees of mobile clinics in Tajikistan. Savdat Vatanova, please come to the stage. And also, we would like to thank Sumania Ahmadzadeh, and we would also like to kindly ask you to give her the certificate because she's not present right now, but we would like to give her this award remotely. Distinguished Anna, distinguished colleagues, dear friends, dear compatriots, I'm very thankful to the government of the Russian Federation for financing this very important program. And it is especially pleasant for me to be among those doctors who've got the certificates, among other colleagues from different countries. My colleagues that work in the same mobile clinics, my colleagues from Armenia, Tajikistan, Uzbekistan and others. As a gynecologist, I'm very happy that I can help girls and women, ladies, those who don't have the opportunity to visit a doctor for different reasons. And the mobile clinic helps people. I would also like to specifically state that we would like to see the continuation of this project for many years to come. And we would like to deliver on our responsibility and liability as doctors. And we would like to continue to work tirelessly to preserve the lives and health of people in our region, in the Eastern Asia. Well, I meant in the Eastern Europe and the Central Asia. We've always got some very thanking words from our patients. We see in their eyes and we can feel it in their hearts that they are very happy to once again regain their life, and they're very thankful for our knowledge and for our medical services. And I would also like to wish all our countries to continue this work jointly. Once again, I'd like to thank the government of the Russian Federation for this program of technical support for the mobile clinic. And I would like to wish all of us to be healthy, to be successful in the future. And please, good luck. Thank you, and thank you for your attention. Distinguished colleagues, by this, we mark the conclusion of the opening part, the welcoming part of our session. And if you don't mind, then let's turn to our first plenary meeting and to the presentation that we've drafted for you jointly with our colleagues to assess first and foremost the current situation and to also consider the vectors of the movement forward for the future. Dear colleagues, please, could you show my presentation? So, what we can see and what we know, what we've known, and what helped us to forecast quite a long time ago the epidemiological unwell-being. This is the dynamic of biological threats in our region. And you can see on this slide different cases of plague and also different cases of polio, of cholera, measles, frenzies, and many other infections that haven't been presented in here. The changes that we've been observing and that are connected to the fact that we changed our lives, the mode of our lives. We increased the migration. We developed our technical capabilities. We developed the capabilities of synthetic biology, and it all just indicated that we changed the world, the climate, the nature on our planet so much that something should have happened, and it happened indeed. From the end of December of 2019, we are working under absolutely different conditions as compared to the previous ones. As of today, if we talk about the situation in the Russian Federation, well, more than 12 months have passed, and we can say that the development of the novel coronavirus infections, if we calculate the morbidity for 100,000 people, well, we see that today we occupy the 79th place across the whole world, but we haven't rose further than the 60th place. And from the very beginning, we set the task for ourselves, and actually the first PCR system was registered on the 11th of February, and from the 15th of January till the 11th of February 2020, it was just working for the scientific purposes. So we developed all that, and currently, per 1 million of people of testing, we are among the top 10 countries when it comes to the number of testings. And well, usually we just calculate the countries with a population of more than 10,000 people, because of course it's all about different quantity, but we can see that the coverage of testing in the Russian Federation is quite a large one, and the estimated average infected cases in Russia, the coefficient is 5.8, and we are currently at the 79th place among other countries. From the very beginning, we were working jointly with our colleagues from CIS, and upon the request of the President of the Russian Federation, Vladimir Putin, and he requested us to do this from the very beginning, which I mean it was done in the 20s, around 20th January 2020, we had to provide for methodological support of our activities, and we had to provide our colleagues in the Eurasian Economic Unit Council the testing systems. And we also provided the testing systems to our colleagues and the subjects of the Russian Federation. Here you can see the dynamics of the infected cases and the overall number of infected cases per 100,000 people. Well, there is no country in the world that has avoided the threat in the world, or in the CIS, or in the Eurasian Economic Union. So here you can see a brief algorithm of our actions and what we've been doing. First, the monitoring of the situation in China. We started to do this on the 31st of December, when we learned about it from WHO. And here you can see that on the 15th January 2020, our scientific center Vector developed 2 sets of PCR tests for the purposes of diagnostics. And after that, we unveiled our mass production, introduced the methodological recommendations, and up to the beginning of March and up to the middle of March, you can see here that on the 2nd of March, the first infected case was registered in Moscow. And from the 17th of March, we believe that the development of the pandemic in the Russian Federation started. Yes, we did introduce some very strict measures when it comes to the border crossing, and these measures were quite a grounded one, because even today in Russia, we do not see the circulation of the coronavirus that has been brought to us in the first half of the previous year from China.
And again, I want to state that from the very beginning we were speaking, and we are already stating this from this tribune, that the infection has no borders. It is obvious, but we were taking a task for us and are working on the realization of a united epidemiological space on the territory of CIS and of the EIU countries. So here is what we've done. From the very first days from January last year, we were holding the sittings and meetings of the working organ that we have already, and it's fulfilled the obligations. Every week or 2 weeks we had the meetings with interchange of information on the situation, and my colleagues that are now in the presidium, and they were and are remaining the active participants of these sittings and meetings of the board to coordinate our activities. And also within the framework of the CIS Coordination Council on the issues of sanitary protection of the territory was the second instrument that provided for proper coordination of our activities, to share with our colleagues all the methodologies and to accept the best practices from our colleagues. And as a result, in July 2020, we've passed the plan for the complex healthcare and sanitary well-being of citizens of our countries against coronavirus and other diseases within the EU, and the midterm plan for the cooperative actions of CIAs in combating and counteracting infectious diseases, and then agreement on sanitary well-being. And this document has the supreme power because it is signed by the presidents of the countries, member states, and these documents are now effected. And speaking about the Federal Service for Surveillance on Consumer Rights Protection and Human Well-being, we are stating that we have 23 scientific and research organizations, 17 of them are epidemiological and microbiological institutes, and this is very important for us in this not simple situation, because this structure, this construction has played its invaluable role. Because, why? Because all the events that we were developing and that we were offering and realized, they were based on the scientific base. That means on the basis of scientific data, research, and endless monitoring of everything that is known in the world as of date, and this was used to form our position. And further, to form and build on the management and governing solutions. Here we have the results of the vector. What was first done? We've initiated monitoring of the changes, because the changes of the virus are making a clear picture on that related to the tasks on actualization of PCR systems or on creation of vaccine. And here from the very beginning, as you can see, on the basis of vector, we've started to test the changes and to provide sampling of our system. And by the way, our system is vertically integrated. It provides for best management of the system, and Vector has samples from all the territories of Russian Federation. And what was very important to do from the very first days of the pandemics, we needed to collect biological models. We understood that not mice, not rats, not small animals, mammals can be models, because they are not susceptible to the coronavirus. And we've conducted this particular work, and we've checked the specificity of the new coronavirus to different tests, different chemical substances. 688 chemical substances were tested for their susceptibility or activity towards the new coronavirus. And unfortunately, as you know, the whole world makes this, and it is not found in the whole world the chemical binding or binder that would 100% fight the coronavirus or the new virus. What was very important for us? We needed to understand how to fight against this. We needed to understand the specificity of the virus, and here was the framework of our work. And I can remind you, and I'm pretty sure that you can be reminded of this, that the first weeks of January 2020, we were thinking that this virus is not handled from one person to other, that there is another mechanism. But then we understood that it was not the case. And about the environment, our Central Institute for Epidemiological Research and Development Institute is assessing the environmental affection of the virus, and we've facilitated the pilot project. And then in all subjects of Russian Federation, we are performing due control. We are controlling the environment and controlling it for the coronavirus. And as you see, the plan tests are not making virus the evident, but in the cases where we have diseased persons, we have positive findings in more than 3% of the cases. It is also very important to state the fact that we had to develop these test systems to change the properties and structures of these test systems. This was done also by our institutes, Vector and Central Research and Development Institute for Epidemiology. We were working on the basis of polymerase chain reaction. And it was also very important to understand how to define the immunity. And again, I want to remind you of the March 2020, because we were not able to state at a certain time whether it will be an immunity or no immunity against this immunity. What are the numbers and digits that will state that this person particularly is under protection? We were working on the basis of IgG, immunoglobulin G, for post-infectious immunity in persons, in patients. And we also solved the task to create express tests for antigen and express tests together with the IFA technology. All these test systems are now used in our laboratories in the Russian Federation. Also, a very important topic that we were not forgetting about, as it was stated from the very beginning of this conference, we were speaking that coronavirus is a very important topic that took many lives, coronavirus per se, but we don't have to forget that the other infections are not gone. They are here, they persist. And as of now, we are speaking that unfortunately, and this was also mentioned in greetings from our colleagues from UNAIDS, for example, in the year 2020, there were more problems in access to antiretrovirus therapy. And now we have to put the task on the urgent overcoming of these issues that are posed by the time being. The today's current situation in terms of infection related to the HIV virus. It is represented on the slide. We see a dynamics, and this dynamics is certain, but for the first time I want to speak that the masses are growing. That means masses of people who are getting their tests. Of course, perhaps with this we see some decrease in the evidencing, but this is a huge task for all who are engaged in the works in the region in combating against the HIV. In Russian Federation, we have for many years a program and we are investing many efforts in realization of a program for help of the countries in combating the HIV infections. We have sustainable professional relations to the international specialists. We have scientifically based rehabilitation programs, preventive programs for children and women in Central Asia. We have the increased control for infectious diseases, express test on the basis of mobile clinics against HIV, and we've supported the not only urban but also all other stations. As of now, we have more than 3.5 million tests for HIV, studied more than 4,800 people, and the information campaigns in 5 countries are covering more than 5.5 million of people, and we have 13 mobile clinics that are working in 4 countries of the program, and they render the services for 2.5 million of people, and there where the medical assistance is not excessive at the time being. So our cooperation project with the FAO, Food and Agriculture Organization of the United Nations, we are testing microorganisms towards the antimicrobe drugs, because I need to remind you that the tactics of treatment of all COVID patients is pretty much the same in the whole countries, and it suggests significant use of many types and many antibiotics per se. And we are staying on the edge here because there is a huge risks in microorganisms that are poorly resistant to the antibiotics, and we are seeing this already now. We are running these works, and to avoid this factor that is affecting NMR with the food intake of antibiotics is very important. And I want to especially thank our colleagues from Armenia, Belarus, Kazakhstan, Kyrgyz Republic, and Tajikistan who are involved in these projects, because it is very important. It will gain in importance more and more. We need to be very precise here. The projects of international medicine and sanitary rules in the Asian countries is held by 18 profile agencies out of 8 countries of the region. They are united in one monitoring system. And as of now, in this year, we faced the first monograph on realization of international medicine and sanitary rules on the Eastern Europe and Central Asia, with participation of specialists from 7 CIS countries. This is a huge amount of work, and this is a very important amount of work, because we need to prevent and block the localization of any infectious initiative statuses that we are dealing with right now. There is a huge task in assessment of population immunity, because we all know that the development of the infection is put on hold when there is a herd immunity, high level of herd immunity, and when we have a growth in immunized people and in shaping of the immune population. To assess this, to assess and understand how and what is happening, we're realizing project on Armenia, Kazakhstan, Belarus, Serbia and Uzbekistan. We've ran this work in the Russian Federation, and as of now we're using the experience that we've gained during this pilot projects. We are cooperating with colleagues, with practitioners in different countries to assess collective herd immunity of all populations in different age groups and to understand the level of serum prevalence in different groups of the population. That will provide for additional planning of the events, to make forecasts and to understand the necessities in vaccination in defined groups of population. For us to clearly and rightfully to realize our knowledge and practice together with our colleagues, during the last year we've made a huge amount of norms and regulations. It was not the case before. We were rationally working. This basis is providing for methodical recommendations, and methodical recommendations can be changed along with the situation and along with the new knowledges. All services, agencies render, all services are rendered according to the recommendations that we've made available for all the sectors of economy. In the last summer, we've made it real, and we realized the healthcare company, and from the from the start of this year, we've made it possible for the children to go to school without any outbreaks and without COVID distribution in children and adolescents. We've made it to change in terms of change of the norms and regulations of the legal basis. And here you see the results of our consolidated activities together with the colleagues from different branches, from different levels of executive bodies, of authorities of Russia, to form everything which was stated in the 3 decrees of the president. We have a new law on epidemiological safety. We were forced to work on the administrative and criminal punishment level to make more severe sanctions in these terms, and we've backed up the plan for the development of federal state sanitary and epidemiological surveillance on the territory of Russia. And I also wanted to state the following: for the CIS member states, for monitoring, operative notification and due time of reaction for the sanitary and epidemiological character actions, we have also sanitary basis of the member states in CIS, and through this base we have the possibility to realize our methods, our knowledge, and the tasks are provided as follows. And I want to state that in 2018 we've shaped the united system for CIS to react against epidemiological threats on the series of the base of Institute Microbe in Saratov. We've started 2 programs, and we enhanced the functional of standardized functional informatization systems, and this is very important. We will work on this. This is also a very important problem because we are working with live people. We are working with the doctors. Not all the doctors were aware and are aware even now how to work in the outbreak parts of country, and we needed to provide for additional trainings for the doctors. And here we see the program for the preparation of the and retraining and additional training of our specialists. We've managed to train more than 500 profile specialists from profile agencies and more than 1,000 specialists from other countries, from foreign countries, in terms of sanitary and biologically well-being and safety and new technologies in the epidemiologically and laboratory diagnostics. We were working with the teams of rapid reaction in the years 2017, 2018, and we've planned also the study, the similar studies in Kazan in the autumn this year. And I am pretty sure that all the responses to your offers will be realized, and we will be able to make it as a reality. And it's very important that we rendered a significant help to the colleagues and to the people from different countries. We've during the last year we've made more than 20 missions in 16 countries. We were sending test systems. We were working with Guinea, with Vietnam, for example. In Tajikistan, we've enhanced the quantity of laboratories up to 11. We introduced the new recommendations for several countries. We had 10 training seminars, and so on and so forth. And of course, we need to state that we have a united epidemiological space. This is one space. It is united. There are no borders for infection. There are no borders for nature infections, outbreaks from the nature, zoonotic infections. For example, the animals who are the basis for zoonotic infections, they don't know anything about the borders. The herd immunity is shifting, and it is all an important system of our monitoring. And of course, we wanted this work to be done in a more active way, to be realized proactively, to be held on the territory of our member states. And of course, we want to thank the WHO for the support of multilateral mechanism and coordinator of global efforts in the healthcare. I want to thank you for your kind attention, and I want to wish you good luck and success. And I do hope that as of today, we will manage to discuss all the tasks and arrive at great results. Thank you very much. Thank you. And now I want to invite you to listen to the reports of our colleagues that are a part of the plenary sessions. And I want to let the floor to Ms. Shannon Hayder, Deputy Director of UNAIDS. Ms. Hayder is the head of the program activity of UNAIDS, and today we've heard very great words related to her, and we want to join to these words. So, Ms. Hayder, the floor is yours.
Great, thank you very much. It's really my privilege to be here with you all today and to join this important conference. Can I get my slides up? Great. Thank you. And not only privileged to be here, but to have already seen in the video and heard from Dr. Popova the real importance of this regional cooperation program. We feel very privileged to be a part of this partnership and look forward to working together for years to come on these important works. Next slide. Or is there a slide controller? Great. So just a little bit of a snapshot of what's happening globally with the HIV epidemic. And as a reminder that as we look past over the last 40 years, we've had over 76 million people infected with HIV and over 33 million people who have died of AIDS. Trying to see. I will get this down, I promise. Great. And when we look at the trends, we have made major progress in the reduction of deaths from AIDS, yet we haven't gone far enough. Treatment expansion over the last 10 years has resulted in dramatic declines. However, we are still, as a globe, missing the 2020 targets for reduction in AIDS death. Because of our not meeting the 2020 targets as a globe for reducing deaths, there'll be an additional 800,000 people who have died of AIDS who wouldn't have if we had all pulled together and achieved the goals. Likewise, new infections from HIV are decreasing, but not fast enough, not everywhere, and not for all people. As you can see at the bottom, we'd hoped to have fewer than 500,000 new infections from AIDS each year by the time we reached 2020. But as a world, we missed that. We had over 1.7 million new infections. And the situation in Eastern Europe and Central Asia is even more critical. In some cases, having increased infections instead of decrease. Cumulatively, for having missed the 2020 targets, we've had 3.5 million additional new infections than we would have if we had all made the 2020 targets. So as we recommit, we have bold new 2025 targets that will get us back on track to end AIDS as a public health threat by 2030. The gaps we've seen represent major inequalities in the response to HIV. Some countries have made tremendous progress, some have worsening epidemics, and every country has specific people or communities still left behind. So the new global AIDS strategy sets targets for the HIV response based on evidence. They capture the evidence-based interventions that, when taken to scale, will lead to a breakthrough in progress to reduce new HIV infections, AIDS deaths, and end stigma and discrimination. And importantly, and you've heard referenced a couple of times today, United Nations member states' commitments have been critical to driving bold progress against AIDS. It was historical when in 2001, the United Nations General Assembly had a special session on HIV/AIDS that had arisen from a historic debate in the UN Security Council on the impact of AIDS. And this UNGAS meeting was the first ever special session on a health issue. It globalized health as a political priority for the world. Since then, our high-level meetings have taken place every 5 years to review progress and to commit to new targets and the next steps to get ahead of the virus. But I want to make 2 points about this new next 5 years that we're looking at right now and the last 5 years of the last political declaration. For the first time in the last 20 years, the 2016 political declaration targets were not achieved. That doesn't mean that the targets weren't realistic. In fact, over 40 countries reached the 90-90-90 treatment targets. The problem remains that progress is uneven, being made in some countries and not others, for some people and not others. And so that's why a frame of the next 5 years from the United Nations Global Strategy on AIDS is to end inequalities so that we can end AIDS. Multiple intersecting inequalities affect people and drive the HIV epidemic. Some people in some places are benefiting greatly from the new science and technologies, services, and other people are not benefiting from that at all. Evidence shows that this next stage of HIV response is no longer one size fits all. It is about making sure those who are most affected by HIV are empowered to minimize their chances of infection and access services that help. And we must recognize that, of course, COVID-19 has increased many of our challenges in the HIV response. Make sure I got back to the right one. We've seen challenges in services, in logistics and distributions, but we've also seen a new urgency and an opportunity to adopt ambitious thinking and innovations to fight outbreaks and end pandemics. We've seen innovations for HIV service delivery, even as we've seen some of the inequalities that drive HIV in terms of poverty, education, access grow. And importantly, our collective investments in the AIDS response to date have been truly important to progress against COVID. And we've heard about a couple of those examples here today. The mobile clinics that are part of the Regional Cooperation Program that were great for HIV services and for primary health care have become critical to reaching people on issues of COVID as well. The science, the epidemiology, the vaccine and virologic expertise, clearly we've seen dramatic products of the vector vaccine work that certainly intersects with the work from HIV/AIDS. So it's important for the world to also realize that our investments in the HIV epidemic, in fact, are investments for the global security and the fighting of pandemics writ large. So what are we going to do now? What do we need to look at? Well, certainly combination HIV prevention works, but it's not being taken to scale everywhere and every place. As I mentioned, we're no longer in a one-size-fits-all response for HIV prevention. We do not yet have a single magic solution for HIV. There's not an HIV vaccine. But those still left behind and who are highly affected or at risk for HIV often require more than just one thing to protect them against HIV. Knowledge about HIV and sexual health, yes, but also access to biomedical interventions like condoms, drug treatment, pre-exposure prophylaxis, and access to the societal enablers such as education, income, and protection from violence. To understand how we reach those most affected, most at risk of new HIV infections, we have to really understand who is getting newly infected, not just newly diagnosed. At the bottom of the slide here, you see an example of some work in 2018 that showed amongst new diagnoses in Belarus, Kyrgyzstan, and Tajikistan, over half of those who were being newly diagnosed that were newly infected, not just diagnosed, but newly infected as measured by incidence assays, were women. This makes us ask, okay, what are women going to need to be reached with these more layered and important interventions for HIV prevention? And when we look worldwide, we will only end AIDS as a public health threat by addressing the needs of key populations: men who have sex with men, sex workers, people who inject drugs, prisoners, as over 62% of all new infections worldwide are among key population members and their partners. And in many regions, this is over 95, 96, 97, 98% of all infections. We have seen, when we look at the region, perhaps a stabilization in the number of new cases of HIV, and we look forward to seeing sustained decreases, which is what we really need in terms of new HIV cases and infections. As we look towards 2025, as we look to see where we're starting from 2020, it's really important that we get the most recent and complete data from all of the countries in the world, including in the region, so that we can know collectively where we're starting and where we need to get to reach the SDG target of a 90% reduction in new HIV cases by 2030. And again, some of these bold cascade targets are achievable. This here shows that when we look at the 90-90-90 treatment targets, as I mentioned, we have over 40 countries that in fact will have achieved these bold 90-90-90 treatment targets with the 2020 data. These targets, of course, were considered aspirational when they were first put in the strategy, yet over 40 countries will meet them. Here you see that 2 countries have already surpassed the 95-95-95 treatment targets. These are Switzerland and Eswatini. You can't imagine 2 more very different countries, yet both have created their own responses, their own systems, used their data to find the people who need the resources the most, and have covered 95% of their goals. When we look across regions, certainly progress in HIV testing, in treatment, in viral suppression, they vary. Progress is unequal by region, but gaps, the specific gaps, also vary by region, as they vary by country and even within countries. In Eastern Europe and Central Asia, there has been a lot of success in HIV testing. People living with HIV are being diagnosed, but there remains a big gap in those people getting on HIV treatment. At the end of 2019, the cascade in Eastern Europe and Central Asia was 70%, 63%, and 41%. This is another way of looking at the progress in the HIV testing and treatment cascade in Eastern Europe and Central Asia over time. Importantly, I want to direct your attention to the final column to your right there. That's the mid-year data on new diagnoses for HIV. And although HIV testing volumes have been affected by COVID and reduced by COVID, we actually see in that far right gray bar that the number of new diagnoses for HIV have increased compared to other mid-year terms. So somehow the right people are being found, maybe found even more effectively, even as the overall testing has been impacted. When we look at vertical transmission and new infections in children, we again, as a globe, have made great progress since 2010. However, over the last 2 to 3 years, progress has stalled, and we're seeing different reasons for that in different countries based on the state of their programs. In some countries, this is because pregnant women and breastfeeding women are never accessing HIV services at all. In other countries, it's because they're accessing, but then falling out of care or being lost during pregnancies. And then in other countries, some with extremely successful HIV vertical transmission programs, it's not that the women who are HIV positive at the beginning of pregnancy or breastfeeding are falling out of care, but there are women who are being newly infected during pregnancy and breastfeeding who are accounting for the remaining pediatric infections. And I'd point out that women who are members of key populations are oftentimes most at risk of being those women, of not being able to access the combination HIV prevention services they need during pregnancy and breastfeeding. Yet across these services, where we have really found power is when communities are at the center of the response. The JIPA principle, greater involvement of people living with HIV, has been an underlying approach that has been critical to governance and decision-making, to the direct delivery of services to people, and for accountability. Community-led monitoring helps ensure that what's been promised by government, by partners, is actually being delivered on the ground. And then finally, and unfortunately, stigma and discrimination against people living with HIV and key populations remain. We are far from the zero discrimination goal. People tend to think of stigma and discrimination as something organic, something that we just have to wait to change. However, there are evidence-based ways to reduce stigma and discrimination, but they need leadership commitment and funding in order to be implemented powerfully and at scale. Apologies for my lack of agility with the clicker. And importantly, when we talk about resource needs, our 2020 projected resource needs were never fully funded. And as we've already talked about, the world did not achieve our HIV goals. As a result of those 2020 goals not being achieved, the price tag has gone up. The global price tag to achieve the 2025 targets is actually higher than it would have been had we achieved the goals so far. It's those 3.5 million new additional HIV infections beyond what the targets would have projected that mean we have a lot more work to do now than had we gotten ahead of the game earlier on. So the new price tag is for lower and middle income countries, we need about $29 billion to reach those 2025 targets. But importantly, this $29 billion, it's not a development assistance goal. It's a total package of money from all sources. Over half of that budget is from upper middle income countries. And so we do expect that domestic resource mobilization will really cover the bulk of those monies. So when we look at these new 2025 targets and the new global AIDS strategy, a few things worth pointing out about the boldness of these targets. First of all is that the service targets, it's not just that they're going from 90 to 95 for treatment, for prevention, but in fact that 95% coverage applies to each highly affected group so that we can eliminate inequalities and minimize those left behind, making sure that those we need to reach are not hidden in the national averages or global averages of success. And then finally, for the first time, these targets include specific, quantifiable, evidence-based targets for social enablers to reduce measures of stigma and discrimination to less than 10%. So when we look at the Secretary General's report from the United Nations on the future issues to be debated and negotiated in for the high-level meeting in 2021, here's the list of topics that we must address in order to make progress. So we hope that everyone from all member states, all your countries, your governments, we hope your experts will help your politicians rally around this important event of the next high-level meeting on AIDS that will happen in June 2021. It'll be a hybrid event, part virtual, part in person, and as you can see, there'll be a number of activities leading up to that event that are very important. Everything from later this week, interactive multi-stakeholder hearing in response for the preparation of the HLM, to the start of formal and informal negotiations on the political declaration, to then the high-level meeting itself, at which point we hope that all member states will again have come together in solidarity, in commitments to bold and important targets, so that we will, in fact, make progress and achieve the results we need to really end HIV as a public health threat. So thank you.
Thank you very much, Madam Haidar, for this extensive, very clear report. It was very important for us all to hear. And distinguished colleagues, now we have Jens Lundgren from the University of Copenhagen. He's an infectionist and he has extensive experience when it comes to the treatment of different infectious diseases, including HIV and AIDS. And at the beginning of the coronavirus infection, he led the full-scale test and study on the medications against the coronavirus 45 once. And today we asked Professor Lundgren to take part in this conference, and he will be speaking about COVID-19 and its effect on HIV and AIDS. So please, Dr. Lundgren, the floor is yours.
Dr. Lundgren, we cannot hear you right now. Your sound is off.
Can you hear me now?
Yes, thank you.
Okay, I think that's...
Спасибо, вас слышно и видно очень хорошо.
Yeah, thank you. We can hear you very well.
Okay, very good. So, looking at those two infections, it's striking how many similarities and interactions there is. We know now that HIV positive persons are at excess risk of COVID-19 disease progression. And equally, we know that HIV care is significantly disrupted by the COVID pandemic. On a biological sense, it's also interesting to observe that the... Excuse me?
We can hear you. It's interpreted simultaneously.
Okay. So if people could put their microphone on mute, that would be helpful so I don't hear that back, please. Thank you. On a biological level, it's also interesting to observe that the risk of the infection depends on the inoculum size. So the larger, excuse me, can somebody please turn off their microphone so I don't hear that in my ear, please? Thank you. Okay. Equally, it's interesting to observe that the development of concepts for prevention and treatment of SARS-CoV-2 currently really at a stage similar to where we were with HIV between 1995 to 1997. You remember this was the time when there was a breakthrough in understanding of how to treat HIV. For SARS-CoV-2, we have drugs of modest activity, and we are starting to learn that combination of these drugs are clearly the way forward. And that was the revelation in HIV as well. Of course, the major difference is that we know that there is a curative immunity correlate for SARS-CoV-2, which have allowed for the development of vaccines, which unfortunately is not identified. The immune system is not able to cure a person from HIV, and therefore, as a consequence, we still don't have a vaccine against HIV. And the likelihood that this will be developed in the near future is pretty slim. So there's evidence to suggest that people with HIV are at excess risk of contracting SARS-CoV-2. I don't think that's surprising. It's probably mainly determined by social determinants. When you're HIV positive, the chance that you're living alone is increased, and therefore you're seeking social contacts more often. It's not possible to maintain a social bubble in your social network, so you have contacts with more people. You may seek sexual contacts with other people, and that explains, I think, that part of it. It's also becoming clear that the mortality, if you're infected with SARS-CoV-2 from COVID-19, are increased in persons who's HIV positive. However, it's also important to emphasize that the HIV factors that is affecting the prognosis really depends on whether you have access to treatment to treat your HIV disease. looks fairly consistent that for people with HIV who is on effective HIV treatment, they have pretty much the same risk for COVID-19 as people who do not have HIV. In particular, if they have been on HIV treatment for 6 to 12 months. And this obviously puts a major burden on the health system to continue to accelerate the testing for HIV, as well as placing people on HIV treatments, in particular in high prevalence areas of the world, like in Eastern Europe, including Russia. The data suggests that those at increased risk of contracting a more poor outcome from COVID-19 are older adults and people at any age who have serious underlying medical conditions. And of course, we know that the proxies in HIV populations for weakened immune systems are people with low CD4 cell count and people not on effective HIV treatment. So again, this is an important take-home message that again emphasizes the fact that HIV is impairing the immune system, and as a consequence on making the body less able to combat other infections where there is a curative immunological correlate. It probably also means that it is plausible that the protective ability from SARS-CoV-2 vaccination is also reduced in people, HIV positive people with lower CD4 cell count than those not on treatment. Again, two other arguments for why it's important to continue to accelerate HIV testing and placing positive people on treatment to rectify this. There's a number of studies around the world to suggest that HIV care was markedly perturbed during the lockdown. This is an example from a study from South Africa, but I believe I've seen data as well from Russia and Ukraine that mimics this quite clearly, that the number of ART collection visits that was missed, in particular during the most heavy lockdown, was markedly increasing, as well as the testing centers that were set up for screening the population for HIV and getting them into HIV care was also markedly negatively affected. And as a consequence, as been alluded to by other speakers in this conference, it's quite concerning that in particular in areas of the world, in particular in the Eastern European region, where there's been so much effort being placed into overcoming the HIV burden, that those efforts, at least temporarily, has been set back, which means that we need to focus even more on this as we get into a more normal situation, hopefully soon. We also know that another disease that is heavily affecting HIV positive people in the Eastern European region, namely hepatitis C, that the public health response towards that is also greatly affected. This is a study from another section of the world, but clearly shows that the testing as well as treatment for hepatitis C was greatly reduced during the lockdown period last year. When that is said, there's also some positive signs here because, and I think other speakers have alluded to this already, that there is evidence to suggest that the way that we are providing HIV care in a situation where we are unable to maintain the HIV service structures that was there before COVID-19, that innovation starts to happen. For example, using multi-month dispensing policies for ART as one example, where you can see in this study from Africa that you saw a substantive further interval between people having to get their HIV medicine just as an example, here you can see that we are now up to over, around 60–70% are receiving medication interval of 3 months or more. I would have to say in my clinic in Copenhagen, we are now moving to 1 year interval. So there's still some distance to go, but it really shows that the burden on HIV care structures can be reduced because you can dispense medicine in longer intervals. Another important development, I believe, that COVID have learned us is the use of telemedicine, electronic means of communication, as opposed to having the patients necessarily turn up physically at the HIV care structure. Of course, some laboratory test is needed, but again, in many parts of the world, we are now moving to doing laboratory tests every year in people who is in a stable situation, and that also will reduce the burden on HIV care facilities, and something that we can learn from despite the hardships that we have experienced from COVID. Finally, just to give you a few comments on treatment for COVID-19. There's been an enormous effort to try to identify effective medications against this infection, which have develops in different stages, from the early stage where people are typically not in the hospital, and then in some people they develop COVID pneumonia, which then further in some people is accelerating to a hyper-inflammatory state that typically leads to the necessity of admission to intensive care units. The antiviral drug remdesivir has been helpful in stage 2 in those with pulmonary disease, not the more sick people, but in that sort of small window of the disease course where people are admitted to hospital, whereas dexamethasone has really been helpful in the more hyper-inflammatory stage of the disease. There's emerging data that potentially in this setting of patients, the combination of dexamethasone and tocilizumab, an IL-6 inhibitor, may be more helpful, although that's still debated. Importantly as well, in people who is hospitalized, heparin to reduce thrombosis risk has become standard of care in many places. There's an ongoing debate about the dosing of this medication. And then finally, of course, if people are hypoxemic, provision of supplementary oxygen. But that's really the stage, I believe, of where we are with medication. And although I believe many physicians have the desire to give sick people more medication, that really is not really what we should do outside of clinical trials. We should maintain focus on providing medication where there's good evidence. And therefore there's been a lot of speculation last year about whether HIV drugs would be effective against COVID-19, including lopinavir, darunavir, and ritonavir. It's now conclusively that is a null effect, and if anything, it leads to excess harm, and therefore HIV drugs are not effective against COVID-19 or SARS-CoV-2, nor are hydroxychloroquine. Again, if anything, hydroxychloroquine leads to net harm if you're providing it either as prevention or as treatment. There's a number of trials ongoing to explore interferon, favipiravir, ivermectin, as well as convalescent plasma and neutralizing antibodies, and those entities are still to be defined in a research setting and therefore not used outside. So in summary, HIV-positive people with impaired immune function, no or late initiated ART are at excess risk of COVID-19 complications, including excess risk of death. We see as well that COVID-19 have interrupted HIV public health measures on many different fronts. We know now, unfortunately, that there's new SARS-CoV-2 variants that escape the immune protection that the immune system is otherwise able to provide us with, and as a consequence of that, we need to think very innovatively around ways to further boost the immune system so it can also protect us against these new escape variants. Medical interventions with documented effect includes dexamethasone in people with severe COVID-19, not in people with less severe disease, really only those in stage 3. The role of tocilizumab, if any, and for that matter, baricitinib, the JAK inhibitor, is to be defined and is still being discussed extensively in the research community. Remdesivir, which have a modest antiviral effect. We call it the oseltamivir-like drug against COVID-19. Oseltamivir is obviously used against influenza. It has its place in patients with moderate COVID-19 pneumonia before they get into the intensive care. It has its niche there. Of course, we need to use supplementary oxygen, where the target saturation in arterial blood should be between 92 and 94%. Don't get them up to 96 to 98%, but that range seems to be where the benefits are most optimal. And then consider using heparin in hospitalized patients. And I just wanted to leave on the note of, again, thanking you for inviting me to this conference. I wish you all the luck in your further deliberation. We have a lot of work in front of us, not only in handling COVID-19, but also to maintain focus on the HIV epidemic in the Eastern European region. And I look forward to continued collaboration with colleagues in Russia, in Ukraine, and many other Eastern European countries, a collaboration we have had for many years that we look forward to continue. Thank you very much for your attention.
Thank you very much, Dr. Lundgren, for your very interesting report, and mainly for your idea and for your eagerness to cooperation and to exchange in operation, because we are speaking together about unity for the benefit of the people around the world. Thank you. And our final presentation on the first plenary session is the presentation of the Director of the European Regional WHO Bureau, Dr. Hans Kluge, and he is not a rare guest in the Russian Federation. He met the head of the government of the Russian Federation, and our cooperation is very valuable for us, and we are really and indeed supporting the actions of the European Bureau of the WHO in terms of consolidation of medical community, political community, to solve the main issue, the main question on how to save our health of our people. And I want to state that Dr. Kluge led the Bureau of the European Bureau of the WHO on the February 2020, and he was the one to face this new coronavirus infectious disease. And I want to thank Dr. Kluge for your great work and for as we can state it and as we can assess it, and for your kindness and for the comfort that is achieved in our cooperation. Mr. Kluge, the floor is yours.
Уважаемая Татьяна Алексеевна,
Distinguished Tatiana Alexeyevna, distinguished Anna Yurievna, distinguished colleagues and the participants of the conference. 2020 opened our eyes to the imperfections of our system, of our healthcare system, as well as the response to the emergencies. The pandemic has confirmed that the old lessons should have been learned, and it taught us some new lessons. COVID-19 unveiled the inequality and underlined the importance of the coverage, and it also confirmed our faith in the fact that the healthcare systems play some significant role when it comes to the protection of our society. The pandemic has clearly demonstrated the gaps and the loopholes in the current world when it comes to the response to the main healthcare challenges. And it resulted into some slow renderings of medical services. And it just made desperate those people who are infected with tuberculosis or HIV. And COVID-19 has also demonstrated the prospects when it comes to the global challenges in the field of healthcare that we committed to deliver on. From the very beginning, WHO focused its attention on rendering the aid to the countries when it comes to the preparation, mobilization of resources, exchange of cutting-edge knowledge, as well as the agreement on the measures. We wanted to minimize the effect of the pandemic, the influence of the pandemic on the public health. But we also do not want to lose the sight of our old foes with some pandemic potential. The experience of global programs in the fight against HIV can show us that the care about the marginalized and most victimized people is the most important task when it comes to the achievement of the third SDG. We see that we will not overcome the COVID-19 until everybody is safe. And it has been clearly stated into the roadmap of WHO on the enforcement of the healthcare systems in the European region. In the European work program, we focus on the goal that nobody should be left behind. When it comes to the work on establishment of equal and fair healthcare systems, we proceed from the experience of the past, and we focus also on the settlement of issues for the tomorrow. And the Pan-European Commission on Healthcare is a good example of that. Pan-European Commission on Healthcare and Sustainable Development. It has been established by myself, and it already issues recommendations on the reconsideration for the future. Our best tools when it comes to the fight against the virus is the solidarity and science, and Russia can offer a lot in this respect. I highly appreciate the leadership role of the Healthcare Ministry of the Russian Federation, and I thank the Federal Service for the Surveillance on Consumer Rights Protection and Human Well-being when it comes to the monitoring of dangerous pathogens. And I applaud the Russian scientists for their amazing developments when it comes to the tools to fight against the pandemic. I'm very thankful to the Russian healthcare system as well as to the bodies of public healthcare for the fact that they are very important partners when it comes to the enforcement of collective potential, and they're ready to respond. The third task of the SDG is to provide for their health and well-being for everybody. And it includes the responsibility to get over the epidemic of HIV, malaria, tuberculosis, and other infectious diseases by 2030. The influence of COVID-19 on the performance of this task can be quite a different one, ambiguous one. So, on the one hand, the pandemic can thwart the progress when it comes to the achievement of the goals in the field of healthcare. But on the other hand, secondly, I believe that in the upcoming future, we will go back to the way of the full coverage by the health services. This is very important, and that we also get back on track when it comes to the achievement of SDGs. And our actions will be more determined also because of the pandemic. That does not leave us any other choice as to be very active here. Thank you very much, and good luck. Thank you, Mr. Kluge, for your amazing, wonderful, emotional presentation. Thank you for your wonderful Russian. Distinguished colleagues, the program of our first plenary session has been over, exhausted. And so if there are no objections, then I would like to ask our colleagues to open our break. Alona, do we have any other announcements to make, any comments to make, anything? If you have any, please go ahead. Well, we will start our parallel sessions at 11:30. Now we will have a break, 30 minutes, a bit more, and we'll have a lunch break from 1 p.m. to 1 p.m. 45 minutes. Okay, thank you very much. Good luck with the session.